Hello
Yeah,
everyone, and
I'm
welcome
good to go.
to yet another episode of the Sugar Diaries. Today we've got 4 people, 4 friends from 4 different continents, and this is a special interview because it's with our friends from all over the world. So Madhura and I are going to interview Lucy and Gavin, and I'm going to now request them to introduce themselves, tell us where they're from, tell us about all the great work they're doing about diabetes in their countries. So Gavin, over to you.
Thank you. I would say ladies first, so go ahead, Lucy.
Okay. I'm Lucy John Bosco from East Africa, Tanzania, and I've been living with type 1 diabetes for almost 20 years right now, and 33 years old. So it's like half of my life I've been like living with diabetes type 1, and I run diabetes NGO. It's called Diabetes Consciousness for Community. It's like diabetes awareness and all that, yeah. And professional, I'm a journalist, and I'm a radio presenter. I'm producing and hosting radio segments based on diabetes. So, and I do write articles in a most popular leading newspaper, a local newspaper in Tanzania. And my column is called Life and Diabetes. You know, it's more on bringing up the awareness, diabetes awareness, especially type 1, because most of people in Tanzania, they don't have enough or correct information of diabetes, especially type 1. And also another challenge is there's a lot of misinformation when it comes to diabetes and when it comes to what to eat, how to live, and all that. So my column and my radio segment is only based on educating people about diabetes, how to live with diabetes, how other people can live with people living with type 1 diabetes, what to eat, what not to eat, how to feel, make yourself comfortable with it. And yeah, that's all. That's all. And I'm working as a diabetes educator in one of diabetes center here in Dar es Salaam, Tanzania. Yeah, so
Lovely.
that's all.
Thanks, Lucy.
That's
Over to you,
me.
Gavin.
Yeah, brilliant. Thanks, Lucy. And yeah, my name's Gavin, and I'm from the UK. I'm from just outside of London in England, and I've lived with type 1 diabetes, same as Lucy, for 20 years, diagnosed on the millennium, so not hard to forget. And I'm into sports and stuff on my own personal passions, and so perhaps that's where I got better known in the past. But I started something called DiAthlete, which is now on its way to being a charity incorporated organisation over here in the UK. But we also have a program called the League of Diathletes, and so we have a local team of really advocates living with type 1 diabetes who share a passion to make improvement to healthcare in diabetes, making it more relatable and more encouraging for people, particularly families and young people dealing with this condition. So we share our personal experiences as an example, and we make education more fun, more relatable, and more practical with games where you can learn, and we operate trainings and fundraising challenges. So we have also a network of patient organisations that are grouped together in this league. And so, yeah, there's a good little collaboration across quite diverse. In the UK, we're quite privileged, if you like, because we've got access to things.
Yeah.
But I think the universal challenge that exists here, as it does in Africa, as it does in India, is education. And I think that's where patient experiences people living with this condition, we have such a strong voice to actually make a difference, because sometimes health comes away from care. We need to combine the two. But the Song in a Better Foundation themselves, for some of the lower income households, they actually fund the insulin and they fund the testing meters as well. So I know that system's not set up in the country, and so it shouldn't be happening. But that's what a goal is long term, perhaps, is to try to change from within.
Wonderful. That's great.
Yeah, for me, as like me and my team, we saw maybe let's us focus on raising and spreading only diabetes awareness, because there is already an association which is well known with other global diabetes alliances and all that. So we only we figure out, okay, those are only focusing on providing insulin.
Exactly.
But there's another issue, or there's another challenge, which is education. For us, we don't have any support. We don't have any income to provide for them the insulin, but we can provide education. So that's why I believe that diabetes awareness or education is a first medicine. Because if you know what to eat, what not to eat, how to live, it's easy for you. And our biggest challenges is there's a lot of doctors in the streets, who will tell people like, no, your kid has a diabetes. No, she's not supposed to eat this. Eat this. So it's like, okay, we have Tanzania Diabetes Association. For them, they only deal with making sure that the children get insulin. And for us, so we can work together. Let's provide education, and maybe you can but there is a challenges club in schools, because there's no any diabetes club. There's other clubs like Bavaria club, HIV club, sports club. I was like, what's up with diabetes clubs? We need this, because we found out that there's type 1 children in schools. Teachers don't know about diabetes, so we started educating teachers, let them know about all the symptoms, the hypoglycemia, the symptoms, and what to do, and all that. So now when the COVID came, everything has to let's hold first. But this one day I saw that the data in CNN that people living with diabetes, sickle cell, asthma, and all that, they are at a very high risk. So in our community, in our local community, starting asking in my page, people dropping questions. Now, Lucy, you see, we are the targets now. So I saw that temper, I saw that panicking and all that. So I had to do a show in my radio. So I had to do a show. I had to interview some doctors to make things clear. So at least people that to reduce the packaging attack and all that. But people are freaking out. We have diabetes, so are we gonna die? No. I have diabetes, but it's true that we are the target. But no, we're not. As long that we follow what they're advising us.
And what about you, Gavin? How was your experience before COVID happened?
One way or another affecting us.
Well, with COVID, it's a weird situation that nobody saw coming, perhaps. And even when we did hear the word Wuhan, nobody acted on it in terms of government in the Western world. We were all very too naive. And so obviously it's affected a lot of not just businesses, but charities and grassroots work. And for me, agreeing with Lucy entirely, I think whilst there are funds about going into resourcing things which are important, the most important work in our cause is grassroots. It's from the ground, from personal experiences, reaching people in a relatable way. And certainly a lot of my projects were about that impact, face-to-face, community workshops, practical sessions and seminars. And we had a lot of things booked up and whatever else, but of course, it's all locked down here in the UK. So for the foreseeable time, things are on hold, postponed, and that's unfortunate. but we've had to look to other ways to try and reach things. So with DiAthlete in the UK, I had a lot of workshops and these are sports clinics, I call them, where we have team insulin taking on team carbohydrates. So we learn about calculating your meals in a sporty tag rugby game, or what you like in India, learning about diagnosis. Why was I diagnosed? A cricket game where team beta cells and team immune system, the immune system trying to bowl out the batting insulin run scoring beta cells. So we're making it practical to learn, and it's fun for young people and people in general, perhaps to see diabetes in a different light. But that all got put on hold. But now we have to look at, well, can we do this online? So I was partnering with hospital teams over here to do these sessions, and I can potentially, it's not the same in my opinion. I love the face-to-face, seeing other people with diabetes come together. It makes such an emotional difference. But we can't, there's things like Zoom. We're talking now from 4 different continents as well on one online channel. So there are online platforms to bring people together and at a lower cost. So it is possible to look to other ways, and that's something I'm doing at the moment. But it's not easy to, when you've got all that work. And we actually, with the League of Diathletes, with the global team, we had a big coup. One thing we mentioned this on in a Better Foundation, this Boda taxi network was something they thought, well, the kids can't get out of their house because they're locked in. They're in lockdown, so they're not able to go to the diabetes centres, even if it is 5.5 hours away, which is too long in general, to go and collect what they need to survive. Of course, going to collect them in general is an extra cost. What was shared on the weekend was the low income earning in Uganda is approximately $1 a day. So that's around $30 a month. Maybe people getting $30 to $40 per month on an income. The cost of diabetes care is about $100 a month. And then adding to that, travel to go from your house, whether you're getting taxis, whether you're driving, whether you're walking some, and getting a bus. This is an extra expense out of your pocket. 2 diabetes costs per month to pick up what you need to live. So this Boda network of taxis that are being financed and resourced, perhaps it's a way. Yeah, we were thinking initially, they were thinking for COVID-19 to cover people now because they're locked in. But actually, this is something that can work in the future, because if we can continue to fundraise and continue to get sponsors or whatever else we can get in to get that network financed,
right,
it's going to help people's lives, not just because of COVID, but in their day-to-day living and lessening the expense.
Makes sense.
Things are a bit different because not everyone has a health insurance. And for those who has a health insurance, their insurance, it has some limitation. See? So now that's the very biggest challenges. And most of those limitations, like you can't take medication for like 3 months or more than 3 months. You're only allowed to have medication for 1 month, you see? So that's the very biggest challenges in our country. But other thing is, like for me, the way I used to maybe educating people, like making mobilize people, give them awareness, and not everyone has access with a smartphone. We can't do like video call, like do like this teaching. That's another challenges. See, and the other thing also. I've been trying to record, put it in a social media and all that, but not everyone follow these things. Most of people in Tanzania, they do follow gossip pages and all that. So what I always do, I try, like, I tell people in my show, and I write it in my column in a newspaper, like, whoever needs education, please call this number. And I also give up the time. So if they call me like 4 people or 5 people, we do conference call. You see, that's works. We can't do the video like G was doing and all that. But the other thing is, most of people do use Vio insulin in Tanzania. They are a bit affordable. The pellets like Novamix, Mixtard, Novorapid, not other children still use the rent and soluble thing in value. That Tanzania is still, it's one of a developing country, and the other people like middle class kind of family and all that, low income classes, we can't afford like gathering foods and all the groceries and like inside home, not going out. That's a very big challenges, because most of people, we like earn our income by going out. We work, we get money, we come back. So that is another challenge. That
yeah, Sawa. So Gavin, how has access to insulin and access to healthcare professionals and all of this changed post-COVID in the UK?
In the UK,
Yeah,
I think I've noticed, if you like, on a positive, is that GPs are making themselves available to call. So we're in a lucky position, if you like, for that reason. Perhaps in regards to, I've recently moved home and started renting, to a new place, and it's been a bit of a difficult job to get prescriptions sorted, and communicate that, because of obviously the GP being closed and that. So that, only not on a general level, but on a personal level, that was a bit of a challenge to trying to get my prescription rights to receive insulin and stuff approved, and then signed up to a new pharmacy and stuff. So that was a little challenge, but not a bad one. And I'd say overall, we've seen I think the problem we have here in the UK, you might have seen the statistics in the world where COVID is concerned, is we pretty much have the worst statistics in the world, apart from the United States. We are, okay, it's not a competition or something, but we've got a lot of deaths here, and really the reason is our health service is very much Jekyll and Hyde. We are very lucky to have a system where, in regards to diabetes at least, you get what you need supplied by the government, which many countries around the world, as we know, do not have. And so that's a very big blessing for those, one big burden taken away to people with diabetes in this country, which is very different around the world to others. But again, education is the problem in many areas. And what we have is quite a disjointed system where we have charities. So basically our hospitals are run as charities in local regions. So they're called trusts. And the NHS, National Health Service, that's the name of our health service, but it has multiple different trusts. And each trust has 3, 4, 5 hospitals under their financial care. And so some trusts are better funded than other trusts. And so it's quite an imbalanced location. For example, where I'm from compared to London. I mean, in London, you've got some of the richest and well-known hospitals, even, or trusts in the world. And so those patients there are going to have everything that they want when they want it. Whereas on the outskirts of London, literally 10 miles, 20 miles outside, you've got a complete opposite. And there are patients that are on mixed insulin, pre-mixed insulin, and not taught how to carbohydrate count. So there's a big imbalance, and it's because of the trusts, the health boards of these trusts are very different, and they make different decisions. And what we've seen with COVID-19 is, well, some of these health boards are making very bad decisions when it comes to how to manage a hospital.
Right.
So you've got COVID patients coming in to the same ward or the same floor where there's a diabetes center. So you've got high vulnerable risk patients that want to get their diabetes checkups just in the same block as the COVID patients being treated, instead of thinking, well, hang on a minute, we need to separate the two here. Yet in another hospital or another trust will make a complete opposite and wise decision and say, well, look, this hospital is now going to be COVID only, and we're going to treat, we're going to have diabetes calls from home instead of in the clinics, or we're going to have a separate ward or whatever, a separate building for the COVID patients. And so the decision making in the NHS has baffled me, to be honest, with some of the things that have gone on. People often blame government, and I do think our government, whilst on one hand have been very ignorant in terms of dealing with the whole situation, I don't hold them responsible for the health situation entirely. PPE, which is the masks and things like that, have not been provided to health workers, and they have to some, but again not to others. So that's a mistake of both the government budgeting and the health boards of not overseeing this. And so yeah, it's kind of a weird situation here, but I believe that a lot of health workers have been put at high risk when they needn't happen to be. And so them health workers have come back home to their families and potentially passed on. They might not have caught COVID themselves, but they're carrying it. And then they passed it on to their family members, or their family members have received it and passed it on to somebody else without knowing. And that's how you spread a virus. And so we haven't, in the UK, we haven't dealt with it very well. We've been too naive, too ignorant. And that includes, we are very proud here of our NHS, but that is a vague bracket, because on one hand, you have hardworking people who have volunteered to go and help people in this crisis, and they deserve every bit of applause. But then you have their managers who have sent them into the deep end without, they sent them to the front line without a gun. And so, it's the complete opposite. And that's unfortunately the situation that the UK's been in. But in regards to diabetes supplies, at least, yes, we have a system here that obviously it's got a lot of privileges that people have received, and where I've struggled with my fundraising, if you like, is that people are very naive to that, because they've been, understandably, they're just dealing with their own personal diabetes every day. Their eyes have not been open to the world outside them, and when you try to do that, as the campaign has been trying to do, it's hard, because people just want a cure. They just want the pump or the best that they can get for themselves today, or their child, or whatever, without thinking there are people in the world who are not receiving insulin, not just in this pandemic, but they have to pay out-of-pocket expenses in many countries around the world that these people have never even imagined could be possible. So it's hard to turn people's attention to that and raise the funds and make awareness count where I feel it matters more in the world. A lot of people would rather raise a lot of money for a cure that I've never seen happen in my lifetime. And don't get me wrong, we want research to progress. We want funds to go into that area, yes, in the world. But, it's been 100 years since the discovery of insulin, and yet people are still dying because they can't afford their insulin costs. And that needs to be tackled first before we talk about let's cure this.
Yes.
Correct.
So, I have a question based on this for Lucy. As you mentioned, Tanzania is still a developing country. So, how do underprivileged people are managing their condition with this COVID-19, and do they reach out to you for help? And as you mentioned that you are just allowed for stocking up supplies for just 1 month. So how you guys are handling the situation? How do you help them?
Okay. First, you need to understand that there are people who doesn't have first diabetes awareness, and also they don't have COVID-19 awareness. Those are two different challenges, you see. And the other one, no, according to your question, personally, I do buy medicine, but they are. I do help 2 children who they can't afford insulin. So I'm trying so hard. Like for now, I did for 5 months a lot of insulin. So I tried to share with them. But there are other people who can't really can't really afford, because the price is so high, as I mentioned earlier. There's other farmers that they just double up the price of the medication and all that. So it's other challenges. So we actually, for me, I just do what I can to help people. That's all I can do. And as I said, I believe that awareness or education is the first medication. That's what I believe. Because and as I say, there's other area I can't just step on it at all. There are association that it's well known with the government, and it's their duty to carry out other tasks, you know, so I can't step on that, you see. But for our like position as organization foundation, we just like try so hard to like yesterday we met like with 5 diabetes children, type 1 diabetes children, you know. For them, we had to cancel them because in their family someone had a COVID-19, you see. And there are 2 with diabetes, and they also have other 3 friends who they diabetes. So they were like so scared, so we had to cancel them first, you see, to like, because we saw that they have already like mentally shaking up when that was so bad to their diabetes situation. So we had to cancel them, like calm them down and all that. So we managed to like to fix that. Then we had also now to teach them how to protect themselves with COVID-19, you see. So there's a lot of challenges when it comes to the access of like free insulin, free medication and all that. But also there's lack of diabetes awareness, education, and there's also lack of the COVID-19 education.
One final question for the both of you all, and then we'll quickly wrap this up. So, what are your thoughts on the future? Everything is so uncertain now. We don't know when the lockdown opens. The problem, COVID is not going away anytime soon. Even though the lockdown might lift, we still will have to be very, very careful, and the way we live has changed forever. So, what are your thoughts with regards to diabetes and COVID and the future?
Well, for us in Tanzania, our president did make it clear that they are thinking of reopening the university first, and then the primary school, the secondary school will they do later. For us as organization, we, instead of meeting like the whole class of students teaching them, but we are going to like plan a strategy whereby we can only meet not more than 10 students every day, not more than, if the class has maybe 30 students, so we'll do like for 3 days, we meet the 10 maybe group today, the other 10 group, just like that, when we keep that social distance, just like that, because we can't say like we're not doing it anymore. No, we have to do it because still they need our help, they need the education. So we also try so hard to learn any new and right information about COVID, so that when we are starting giving out the diabetes education, we also provide them with a COVID-19 education.
I think over here it's probably the opposite. We haven't been so clear from our Prime Minister. The message hasn't been so clear at all. He had a TV broadcast and he was meant to say, the next steps are going to be this and that, but he kind of talked whiff-waff. And what I mean by that is nobody really knows whether we're out of lockdown now, whether we are still in lockdown, when we're coming out of lockdown, if that's the case. And so I think people have been left a bit more confused by the current situation. We are still in lockdown in theory, that we're at home and we're allowed to go out to exercise twice a day now instead of once a day. That was the message, and we can sunbathe if we like. What I don't know what that means, but the message wasn't so clear, and basically we're on the brink, we would think, of coming out, but really, as you say, nobody's this is not over. It's not over until there's a vaccine. And again, similar to diabetes, we're talking about 100 years ago, Frederick Banting came up with the insulin for humans to be given to humans, and how can that vaccine be transported around the world and given to every household who needs it? And there's an even bigger question that's going to go different country to country once it happens. So who knows how long? They're saying vaccine might be next year. If it is, how long does it take for every person in every country to get it if they're not got the virus already and now they're immune? So there's a lot of uncertain questions.
Uncertain. Right.
Yeah, certainly a lot of uncertainty, if that makes sense. And I feel, yeah, with diabetes, sure. I mean, we're lucky in that we got access to our medicines in terms of the health system, in terms of the diabetes centers and that reopening again. I think we'll see a supermarket approach. The supermarkets over here, you know, you social distance, there's tape on the floor. And so, you know, you stay 2 meters behind the person in the supermarket in the aisle. And then, you know, the frustrating part is you've got to move with them in order to get round to paying for your food. And I'd imagine diabetes centers might be somewhere like that, where you have you know, an appointment at a certain time, and there'll be only a few people having an appointment during that hour. So there's only a few people coming into the diabetes center to go and see their doctor or their nurse, or get their bloods checked. And you know, whilst they're in there, I'd imagine there might be some tape, some seating areas arranged, so you know you're socially distanced apart until whenever it is that a vaccine is there and we're in the clear. But yeah, it's a situation that we all have to deal with, right? And,
yes.
We can only get stronger from learning from our mistakes. Even.
Absolutely.
True.
Yeah.
True.
So thank you guys. Madhura, you go ahead.
Yes, thank you so much, Gavin. Thank you so much, Lucy, for taking time out. And it's crazy, you know, taking
Anytime.
4 people from different continents and time zones together and do this call. So we appreciate you guys coming over here and sharing your thoughts. So thank you so much once again.
Thank you.
And yeah, stay safe and stay healthy.